Kia ora and welcome to No ME, the podcast video series where guest speakers talk about pressing issues surrounding myalgic encephalomyelitis, chronic fatigue syndrome, and long COVID. Join researchers, clinicians, and patient advocates as we take a deep dive into the most recent evidence-based information so that you too can know ME. ANZMES does not benefit from or receive any funds from any courses or products mentioned in this podcast episode. ANZMES does not provide medical advice directly to patients. Please always seek professional medical advice. This podcast is intended for health professionals seeking information on how to help patients with these conditions. In today's episode, we will discuss the lived experience. Thank you for joining us today, Emily. I really appreciate it. I'd love to chat with you today about your journey with illness and wellness, your lived experience. Would you just like to tell us a little bit about yourself, how old you were when you first started becoming unwell, and perhaps what the symptoms were that you were experiencing at that time?
So I first started experiencing my symptoms when I was about 15. Mum, I was quite lucky having mum because she was diagnosed a few years earlier, and she was the one who actually noticed the symptoms with me. And my main symptoms were little things, my hands, my feet, I could never get them warm. No matter how many layers I would put on, they were just ice blocks. I'd go to put my hair up and my arms, it was like they just felt heavy and sore. My sleep, I prioritized my sleep over my life. So it was just things like that really became kind of a red flag, especially because I was so young. So yeah, I'd say for me, I wouldn't have taken notice for it. But for mum, she was kind of like adding these little things up secretly. And yeah, she put it together.
And so how long did it take to actually get a diagnosis through the health system?
So I was 16 when I was diagnosed. I was diagnosed through the rheumatology centre at the Waikato Hospital. It was pretty quick, I would say. She because we went in with a little notebook of everything we had listed down. We were very prepared. And we kind of just laid it out then and there. We just said, look, this is what's happening. This is how it is. She looked at it. She just asked me and she said, look, I think this is what is happening. I'd say within a matter of months, 3 months, it was very clear that I had fibromyalgia. And the chronic fatigue just came with it.
Yeah. And that's part of one of the symptoms, isn't it, of fibromyalgia that people sort of forget about, because it's mostly the pain and some of the other symptoms like you've described before, but it also has that chronic fatigue component where things are exhausting and it's much more difficult to concentrate and find the energy to do things. So that's quite similar to ME/CFS, isn't it? And I think the jury's out on whether people with fibromyalgia who potentially don't recover may actually transition into ME/CFS, but just may not actually get the diagnosis.
Yeah, definitely.
Yeah. So so it sounds like you actually had a really supportive rheumatologist who listened to you and understood.
She was quite, I'd say she was very, well, I wouldn't say she knew a lot in that area. Specifically. I think she was more like, look, this is what it sounds like, this is what it is, not this, it could be these other things. And her answer for the pain and the, it was, here's some tramadol. And for me, I'm a very natural person. I I would like to try anything natural over medication, because I think, you know, medication, it just attacks your body. And yeah, I was 16 and handed tramadol. And I thought, okay, well, it just seemed a little bit careless more than anything. So,
because I guess she didn't, there aren't that many options out there as
well,
to
no,
what we
exactly.
can do. Yeah. So have you gone down an alternative therapy route to see if there are things that have helped you along the way, like massage or
A few years ago, gosh, this is probably about 4 years ago now, I had this amazing lady who did massages, and she specialized with people with fibro, and she did amazing work. You know, she knew the right pressure, the right everything, not to upset our bodies, and it was amazing. You'd stand up feeling like a whole new person.
Wow.
And that, you know, I'd only get it done like once every 6 months. And yeah, it would make you just feel like this whole new person, like you could move differently, and it almost made you feel normal.
That's wonderful.
But, you know, she's decided she would like to do, you know, maternal massages, and hey, that's fine. But, you know, it kind of leaves you with like another, okay, now what?
Yeah.
You know?
Whether you can find someone else or if there's something else to try. It does be a trial and error, doesn't it, of what's going to work and what isn't.
Yeah. So really, I'm very stubborn. I'm very, very stubborn. And unless I really, really, really have to, I won't touch medication. And the only one that seems to work for me is codeine.
Mm-hmm.
So I will, like I say, I have to be very, very sore to have codeine. So that will be the only thing I will touch.
Have you noticed that certain things or activities or stuff going on in your life will bring on symptoms more?
Mostly, I think for a lot of people as well, it's the cold.
Mm-hmm.
The cold is a big factor. It's more like a bone ache, if that makes sense.
Yeah.
In the summer, I do get sore, but it's like an uncomfortable ache.
Mm-hmm.
You know, like I just can't get comfortable, and yeah, it sounds ridiculous, but you know,
No,
people
that makes sense. Yeah,
people with fibro will completely understand.
Yeah, it's sort of similar to the arthritis, isn't it? It's like that. It's in the joints and it's deep within. Yeah. So sorry, I'm struggling with my words. I'll edit that.
I think that's been one of my biggest things, is as I've like progressed, my words are like my biggest, like, you know, I'll slur and then I'll forget what I'm gonna say, and you're halfway through a sentence and you're like, oh my gosh, what was it? What was I talking about?
Yeah, I find that, or you say the wrong word.
Yeah.
You know, I do that quite a lot. You know, I'll say something about, oh, excuse me. See, this is one of my warning signs, as well as my throat gets froggy.
Yeah.
Excuse me. You know, I'll say, oh, could you put that in put the chicken in the dishwasher, you know, meaning bin, and it's dishwasher.
I do the same thing, I think, more times than not. But thank goodness, you know, mum completely understands what I'm saying, because she does it back to me, and it's like, okay, good, we get each other. Or, you know, I'm going to put the butter away, and I put the butter up in the cupboard with the plates, or you know, I put things in the complete wrong area, and then I'm looking for it a day later, and I'm like, oh my gosh, I cannot find it.
Yeah, and that's that strange cognitive foggy brain fog thing that we all experience. Yeah,
very strong.
I wanted to go back to your life pre-illness. So obviously you were 15, so you're at school. What was life like pre-illness as opposed to what you're able to achieve now, what you're able to do now?
I think with being diagnosed at such a young age, it's kind of hard for me to kind of compare it. Like if I was diagnosed a little bit later in my life, then I could have kind of compared it a little bit better. But for me, it was, I mean, I was always never a morning person. Even when I was, 5, 6, I was never a morning person. So that's still the same. I think just even more not so now I've got the chronic fatigue.
Yeah.
Now my energy is just so different now. My peak energy moment will be like 12, 1, 2. Anytime after that, I'll crash again, just like in the morning, and probably pick up again at like 7, 8, 9. And then I have to have my melatonin to sleep because my energy is just like so different. Whereas, before having the illness, it was just very, normal, I suppose.
Yeah, you had that normal
Balanced.
and now it's just haywire.
Yeah, there's just no,
Yeah. So what was it like? What was your experience at school with the school nurses and teachers when you first started becoming unwell? I'm assuming you were having to take time off school. How did that go down with the school?
The nurse was so supportive. From memory, she had fibromyalgia. The newer nurse had fibromyalgia as well. So she was so supportive, and I was so incredibly grateful for her. Most of the teachers, honestly, I think they thought that I was just lying. Back then, it was something that no one really had heard of. Even now, people, I'll say, oh yeah, I've got fibromyalgia, and they look at me like, did you just make that up?
Yeah.
And they looked at me like I was just lying. I had notes from the doctor, and they still just kind of looked at me like, I don't believe this. So if it wasn't for that nurse and being so understanding, she was so more than welcome to come into my office when you need and just sit down and take a minute. I'll call your mum if you need. She was just great.
That's wonderful. So if you could go back now and say to the teachers, like, this is what you need to know about fibromyalgia, what would you say to them?
Just take 5 minutes to look into it. That's all it takes is 5 minutes. It's not hard. It's something that is becoming more common, and it's not hard to believe someone and trust someone when all the evidence is there.
Absolutely. And they must have seen the drastic change in you from when you were healthy to when you became ill, and what that looked like.
You would think so. There were days where my chronic fatigue kicked in a lot, and I'd fall asleep in class, and one minute I would just be full of energy, and then all of a sudden I would just crash. And it was a horrible feeling, having that energy and then just feeling like, oh my gosh, I can't remember anything. Why am I not having anything sink in? And then you'd go to the teacher for extra help because, I'm struggling to remember things and exams are coming up. And they're like, well, you should be remembering those things, they're basic things. And it's like, I'm explaining to you why, and you're not listening. Yeah,
that's frustrating. You probably experience this as well, a bit of trial and error as to what you can do on any given day. Did you go through a process of learning what might bring on your symptoms a bit more?
Oh, definitely. And even now, it's been 6 years and I'm still learning what triggers what. And I mean, I think it'll always be like that.
Mm.
Like, because with the fibro, like I said, came the chronic fatigue. And from that also came the irritable bowels.
Mm.
So now, I had to also learn what I can eat and what I cannot eat. And like I said, I'm still learning things like that. So it's just this huge process of elimination. And, some days you just pick your battles and say, if I really want that today, then I've got to stay close to the bathroom.
Yeah, I know that. I used to have irritable bowel in my 20s as well, and it's like, yeah. You really have to choose what you eat and make sure you're near a toilet.
Oh yeah.
Lovely. So what has it meant for you living with this condition in terms of your life goals? I mean, obviously at 15 you probably weren't sure what you really wanted to do anyway. You were still exploring and learning, but what has it meant for you living with the condition as you've gotten older?
So, I mean, when I was 16, I left school. So I was, not long diagnosed, and I went straight after that, I went straight into my study to become a beauty therapist. And I'm so thankful that I did, because, as I've gotten older, obviously my energy levels have changed. So, I mean, I'm so glad I did when I did. And my goal initially was to have my own business and, eventually branch off and maybe have another one, But I feel like that's kind of over. Like, I can't have my own business now. Like, I don't have the energy to do so. I don't have the memory like I did. I noticed that, especially when I was studying to be in the position that I'm in now, I couldn't remember the things for my tests. It was very, very stressful. It was mostly the energy and the memory because of my fibro that I couldn't fulfill that goal of wanting to be a business owner, and my chronic fatigue. Like, I'm just so tired.
So what have you done to cope with that? So, what coping mechanisms have you gone through?
Gosh, like I said, I'm very strong-minded. I avoid the medications. But I just say, like, I just have to remember it could always be worse. And as cheesy as that sounds, I think seeing so much other illness in my family, it makes me grateful for the position that I am in, that I, with mum having fibromyalgia, she is a lot worse off than what I am. She suffers to a different degree than what I do. And so that makes me grateful for not being, as bad as what she is.
Yeah.
So it's a mind thing, I think. Yeah.
That acceptance, but also not being ruled by the illness.
Yeah.
To some degree. Keeping positive, isn't it?
Oh, definitely. Definitely.
So what advice would you give to a young person who's facing these challenges? What would you say to them?
Don't freak out. When I was diagnosed, I walked out of the rheumatology clinic and I panicked. I had seen what my mum had gone through, and I thought, oh my God, this is what I'm going to go through. Yeah. I was like, in the 3 years that my mum has had this is what my life is going to look in 3 years. I freaked out. So, I probably for a good month, I was just panicking, and that was just worse for my body because I was crying, I was stressed. And so I would just say, don't panic. Do your research and just let your body tell you how it wants to feel, and just go with it.
Yeah. That's really good advice. Yeah. Listen to your body and become informed. Educate yourself on your conditions. And it's so helpful to do that because the health profession is still learning as well. Yeah. So what would you like health professionals to know about fibromyalgia and the chronic fatigue aspects as well?
I would like them to know it from a more personal level. Instead of being so textbook, I would like them to actually listen to someone, or multiple people, and go to some conferences where you can hear people speak and just know their stories, know how it affects their life day to day, how it affects their families if they've got families, and just know it from a personal level instead of reading from a book and just saying, well, this is, all I can say, or tell them it's in their heads, because that is the most hurtful thing you can hear. It is, it's damaging because, you can't really explain how bad it affects you.
Yeah, absolutely. And that's part of why we do this education series, is to provide that evidence-based information, but also this lived experience. And that's the importance of this podcast as well, is to just give them that insight, let them know what the reality is. Because it is hard for them if they haven't actually come across anybody with the condition before. Perhaps, they've learned about it in medical school, maybe a little bit in half an hour session somewhere. And then suddenly, I know in our little town where we live, one of our GPs has a whole bunch of the people with ME and fibromyalgia. And she's had to learn because we went to her.
Yeah, exactly. And it's like, well, why can't she, because she's seen so many of us, why can't she extend that a little bit more and just go to a few conferences about the illness, since she is seeing so many people, just to extend her knowledge, But hey, it's easy for us to say, I suppose.
I mean, they're overworked and understaffed, and
exactly.
There's so many diseases that they have to know information about. So, I mean, I think it's amazing, any of the ones that have subscribed to this podcast as well, so that they are wanting to learn and they want to know. And that's what's so important, is that we're building up that knowledge base out there so that we can prevent some of the experiences we've had where, like for you in the school setting, where the teachers weren't understanding. We don't want that in our health profession. We don't want that to be the experience. And we know, particularly with ME/CFS, that was the experience for many years. And so it's so important to give them this information so that they can learn more about it. Is there anything else that you would like to say about your story to our listeners and viewers, which is the health professionals, nurses, GPs, allied health, like physios?
Just learn the illness. That's all, honestly. That's all I can ask for is, if you know someone personally, listen to their story. Or if you have it, just listen to your body and take it easy. Take it day by day. Don't freak out. Don't do what I did. Don't panic.
But I mean, it's totally understandable though, to come to that diagnosis and having seen your mum, to have that moment of uncertainty and, oh my gosh, is this what my life is going to be like? And it's so wonderful to see that you were able to go to beauty therapy school and you do have clients, so, you are able to live your life to a certain degree. I mean, it's obviously not exactly the way you planned.
It's, I love how my days go. And honestly, I wouldn't change it. I love it. Yeah.
You are your own boss, right? You get to choose how to fill your day.
I can only boss myself around.
Awesome. Well, thank you so much, Emily. I really appreciate you taking the time to talk to us today and giving us insight into your life. Thank you.
You're welcome.